Today I'm going to explain to you a little bit about the Morton's Neuroma surgery and a little bit of how it felt to have it before. I guess I would say it started happening about 9 months ago, where I would get a little bit of tingling in my toes, my last 3 toes, and they would go numb. And then I would have pain on the bottom pad of the ball of my foot. Now, as time went on, when I wore shoes, and I mean any type of shoes, flats, tennis shoes, high heels, it would feel like the bone was wanting to push out the bottom of my foot. And when I would take the shoe off, I wouldn't have pain anymore. So I went through cortisone shots. I tried some massages on my foot. Nothing worked. So I decided to get the surgery. Now I am 2 weeks post-op, and I would like to tell you a little bit about the first 2 weeks. The surgery is quick. It took about 4 hours, and they will tell you you can automatically walk on it, but I say no. And make sure that you get crutches, because the first 2 weeks is not pleasant when it comes to walking. Make sure that after your surgery that you keep your foot elevated at all times, except to go to the bathroom. Make sure you have someone to help you. Also, take your medication as prescribed. I took mine every 4 hours like clockwork. I set my alarm and I made sure I took it. That way I had minimal pain. Now, some people say that their pain was a lot worse, but mine, I'd have to disagree. The most pain I would say I felt was maybe a 3. I took my pain medication for about 4 days, and then I tapered off to 1 every once in a while. Now, the feelings you may experience after surgery will be swelling, and make sure you use ice packs to help keep that down. Keeping your foot elevated also helps with the swelling. Every once in a while, I would feel like that pins and needle effect where your foot fell asleep and you're trying to wake it up. You will feel those prickly little feelings all over the top of your foot. And when it comes to the electrical shock, that's because the nerve has been removed and your brain hasn't caught up with your foot yet. That I don't like, but it only lasts the first few seconds and it goes away. Now, I am 2 weeks post-op, so last week I had the bandages removed, and tomorrow I will have the stitches removed. You can tell when your skin is starting to grow back and try to normalize itself when the stitches get really tight and they start to pull. Now that part has not been so pleasant, and pain medication does not stop that. And I don't think there is anything to stop it. So with all that said, I think it's been a pretty alright experience, and I would like to show my foot one last time before stitches are removed tomorrow, just to show you the healing. Now, I didn't get very much bruising, which is good. And as of yesterday, I started to walk on the foot. Well, I was taking baby steps before that. But the first week, I put no pressure on it whatsoever. Now, my doctor said that I could wear a sock with a Band-Aid over it, but I was like, no way. So I chose to keep mine with the bandage on. You will need to wear that post-op shoe probably for, I don't know, maybe a month. I'll know more tomorrow. But here is my foot. Now this is where the nerve was removed through this area, and I had this area decompressed, which means that the ligaments were cut away from the nerve, just so I don't get neuroma in that one, because we thought that both of them were causing the problem. He said there was a big one in this one right here, so that one got cut out. But as you see, there's not that much bruising. 2 weeks is the turnaround point. You will be feeling probably 80% better. So there's a little bit of bruising down in here. I got a nerve block, so that keeps pain at bay too for the first 24 hours after surgery. As you can tell, I got a little bit of swelling in my feet. I get more at night, and then the stitches give me a problem at night also. But you get over it, and it finally goes away. I definitely cannot wait till tomorrow. But I'm hoping this video helps you, just so you feel more comfortable about getting the surgery and what to expect afterwards. I will continue to post videos of my healing process, and I guess that's all I have to say right now. Till tomorrow, when I get my stitches out. Thanks for viewing. Bye.